Welcome, everybody. My name is Joe Eisenberg. I'm a co-lead with Sue Van Bell in the Climate Vulnerability and Health Challenge Group for the Center for Global Health Equity. So I want to welcome you all to this, I think, the last distinguished seminar for the year that's didn't focus on climate vulnerability and health. And this is actually the first in-person seminar that we've had, though we do have a lot of guests on Zoom. So hopefully that bodes well for the future and having more in-person seminars. I want to thank our co-sponsors, Office of Global Health, Public Health, International Institute, the School of Environment and Sustainability, and Institute for Global Change Biology. So it's my pleasure to introduce our speaker today, Taylor Ricketts. Taylor's a Grun Professor and Director of the Grun Institute for the Environment at the University of Vermont. Taylor's research centers on overarching questions: how do we meet the needs of people, nature, and an increasing crowded, changing world? His recent work has focused on the economic and health benefits provided by people, by forests, wetlands, reefs, and other natural areas. He's the co-founder of the Natural Capital Project, a partnership among universities and NGOs to map and value those natural benefits. Taylor has also served as an author and editor of 2 UN-sponsored efforts to access global ecosystems and their contributions to human well-being. With that, I'd like to have Taylor come out.
Thanks, everybody. It's great to be here, and it's nice to do the sort of last-minute shift to semi-in-person. I'm going to share my screen and get that sort of tech moment over with. Okay, so the first thing I want to say is, given the conversations I had yesterday and last night, I kind of changed my talk. And it's broader than the one that I said I was going to give, because I realized there's some people here interested in another thing that we're doing around health. So this is going to be kind of about 2 projects, more briefly on 2 projects than one. So that's hence the sort of change in title. And before I get started, I just wanted to describe where I work, because it's very similar to the place that's hosting me here. I am a professor at the University of Vermont, and I'm also the director of an institute there called the Grun Institute. And you have so many institutes here that I'm sure it's analogous to one of them, but it's essentially a campus-wide research accelerator to get people to do interdisciplinary work that addresses real-world sustainability problems. So we like to think about doing research that inspires action. So that means collaborating across the silos of universities in ways that universities haven't been traditionally good at, because no environmental problem that I know of is just an ecology problem or just a business problem or just an economics problem. They're all of those things. So we try to get people to work together in new ways within the academy, and we try to get them working much more actively in partnership with people outside the academy, NGOs, businesses, and so forth. So that's what we try to do. And it's similar, like I said, to several institutes that I've learned about since here. We, like a lot of those institutes, have 5 themes that we work on. Again, they map onto a bunch of the interests here. The one I'll be talking about is health and well-being, but as it relates to many of the other ones: equity and justice, sustainable agriculture, climate, and so forth. And every dollar we spend, and every person we recruit, and every project we back needs to address at least 2 of these and the interactions among them. That is our way of trying to be as integrated as we say we are. Every institute is its people, period. There is no anything without the people that comprise these things. We have about 260 fellows at the faculty and postdoc and PhD student level, and about 60 people in 40 other organizations that are our kind of collaborators. They are global affiliates, we call them. And then the last thing I'll say about this institute is the way we try to have impact beyond the traditional academic stuff, because our goal is to help universities show up for these big problems, is we collaborate with a lot of change-making organizations, people with the power to actually change things, either their own behaviors as companies, or in the way they give out money, or in the way they govern various groups of people. So this is the way I think we can take research and connect it more solidly to action. But I've just been learning so much about your own institutes here. I wanted to share back just a little. Okay, so we're going to talk about nature, global change, and health. And just to say where I come from for this, I'm an ecologist. not a public health person, not an epidemiologist. This is all stuff I've kind of learned along the way through my collaborators. I'm an ecologist that thought about nature from a conservation point of view. How do we just save species? When I was in grad school, and that became, so like the people in this picture were kind of the problem to be mitigated. Like, how do we protect nature from us? My career has kind of undergone this slow transformation of thinking much more about people and nature, and in particular, the ecosystem services, those economic and other benefits that nature provides us, water purification, fish, storm protection, and so forth, and so forth. And so these are the kinds of ways I often have started talks like, look at the dizzying number of ways that nature supports our livelihoods. So to me, I spent 20 years trying to quantify in dollar terms the value of nature to people. And that became a little less interesting to me over time. Sometimes the money is just not around, so why value it? Sometimes it's offensive to people to kind of monetize something priceless like nature. And I think a very powerful measure of well-being that's not dollars is health outcomes. Resonates with many more cultures, resonates with many more people, and it avoids the kind of aversion to monetizing nature. And also, it's just more central to the minds of more leaders in the world than money. So this is how I get to ecosystems and human health through that path. And I know that people spend their whole careers working on ecosystems and human health, but I'm a sort of new arrival from that point of view. These are some of the ways that I think ecosystems affect human health, like forest fires create upper respiratory infections, any kind of vector-borne disease where the vector is a wild population is a way in which ecosystems affect our health, and just straight up nutrition. About 1 billion people get all their protein from wild populations, not farming, not livestock, from wild populations. Another thing which is just all too familiar, but needs to be said in this case too, is that the environmental burden of disease, that is the share of disease burden that comes from environmental causes, is not equally distributed around the world. As the map makes obvious, populations that are already vulnerable, already in low and middle income countries, are the ones whose health depends most on the state of the environment. So these are all reasons I think it's important. So this is why I've arrived to ecosystems and human health and why I think it's important. And it's not exactly new, right? Like planetary health is the newest way to think about that. There's a journal now, Lancet Planetary Health. There's foundation-supported Planetary Health Alliance that's now based at Hopkins. I'm sure you've all heard about this, as well as other things that try to connect nature and human health. In fact, in 3 weeks, the provost at UVM will launch her sole campus-wide research initiative, and it's the Planetary Health Initiative. So it's an integrative thing that a lot of people are thinking about now. And I just want to say one other thing for all the people who have been in this world for a while, like there are lots of ways to describe this. I think they're very similar to each other. So I have stopped caring what we call it, right? Eco health, One Health, planetary health, even much of ecosystem services can be thought of as generating human well-being through health. So it's a big thing. People talk about what to call it. As we talked about at dinner, I'm starting to get impatient about that. What I think is much more important is, what do we need to know? So that's our job as scientists, I think. If we think this is important, whenever we call it, what do we need to know to be able to manage landscapes, regions, ecosystems for the benefits of nature and the benefits of our health? And I would argue in like a very simple linear way, which I know is not linear in real life, we need to know something like this. We need to know how a policy or a decision affects the ecosystem itself, exacts some change on the ecosystem components itself, what the ecological effects of that, how that ecosystem actually changes in its components, how that translates into health risk factors, how that translates into health outcomes, but that very important yellow box about mediating factors, like what things protect some people from the outcome when those things aren't true for other people. So risk becomes disease for some, but not others. That was super vague, so let's just do it in detail. Like imagine a forest policy that caused more deforestation, created microhabitats for Anopheles mosquitoes, vector populations of malarial mosquitoes went up, and malaria rates in human populations went up, except for those who had bed nets or prophylaxis or something else, right? Okay, so this, I think, is a full picture of how global change could affect human health outcomes and the various places that we might intervene in order to manage that if we understood it that way. So that's the kind of thing I personally carry around in my head all the time. I'm sure environmental epidemiologists have had something like this for 45 years that I've not read, but this is what I carry around as an ecologist trying to think about the outcome being health. So what I want to do today in this talk is just tell you about two research programs going on at the Gun Institute that I'm involved in personally, money that I'm not, and that relate to the connection between ecosystems and changing ecosystems and health outcomes. The first bundle or program uses big data to get at general relationships between landscape change, landscape composition, and physical health in children. What we've done is taken the DHS surveys, which is USAID's demographic and health survey instrument, 30 or 35 years, many, many countries, country by country surveys. We got a grant from these people, a synthesis center at NSF, to put them all together. So now we have a clean database of it's now 1 million children in 52 countries, all with lots and lots known about them. So we know about health outcomes. Stunting, diarrhea, malaria, diets. We know about social factors, the wealth of the household, the education of parents. We know about sanitation factors like where they get their water, what kind of toilet type they have in their home, and so forth. What we've added to this database is a lot of the landscape variables that measure environment in ways that interest us. So every dot is a cluster of sampled houses on this map. And for every one of those dots, we know the climate monthly for 20 years. We know land use and how it's changing. And for the one that I'm going to show you first, we spent a lot of time looking at the watershed upstream of each of those dots, like through a custom watershed above each cluster to measure human activity, livestock density, forest cover, and so forth. So this is our way of trying to, across many countries and many, many kids under 5, to get the information we need to try to unpack some of these relationships and try out that framework that I showed. Here's an example of just one country so you see what I mean. This is Mozambique, one of the samples. This is 1 year's sample. They're sampled intermittently, and it's not a panel data set. It's new people each time, maybe a decade apart. So this is the nature of the data. 2,800 households surveyed in Mozambique in this survey year. Here's a map of how many households said that at least one kid experienced diarrhea in the last 2 weeks. Right, so just a yes/no variable for each kid. Unimproved water. Which of the households had unimproved water? And here, this human activity thing, it's a shaded dot, but it represents the condition of the watershed upstream of that dot, which was too messy to map. So really, the job has been to relate these variables to each other in as careful a way as possible to see if we find general relationships between human activity in the watershed, its condition, and disease outcomes like that. So I think I'm going to show you 3 very quick examples of questions we've asked. So one is about watershed and watershed disease, kind of hinted at that. A big research question is, how does watershed condition affect downstream diarrheal disease among children? And so again, you can just imagine we have this data set with that structure, and I'm just going to show you what we found right away. So we're going to see a bunch of graphs like this. The y-axis has a bunch of factors. Those are predictors of the probability of a child experiencing diarrhea in the last 2 weeks. And the x-axis is just its coefficient in the model. To the right of the red line is its increasing risk, and to the left of the line, it's decreasing that risk, so it's protecting, okay? So you see some stuff that makes sense, like being wealthier, having higher educated parents reduces risk of diarrhea. Getting older reduces risk of diarrhea from 0 to 5. Improved sanitation does what we expect. Improved water does what we expect. But the relevant thing to this talk is what's in the green box, which is tree cover upstream is protected. It reduces, on average, the risk of diarrhea in kids under 5. And human activity upstream, which we define as stuff that can pollute water, people and livestock upstream, increases that. Okay, so a lot of this is intuitive, but what's interesting to me is even building in and accounting for all the variation that this model captures in stuff we know affects diarrhea risk, that there's still this strong signal of tree cover upstream. That's a signal to me of forests helping with public health. So I just want to make this one step more complicated and we just split the data into urban and rural clusters. And just, again, focus on the green box. You can see that essentially in urban areas, the signal goes away. It's no longer significant, positive or negative. And to me, that also makes sense in that urban dwellers often aren't getting their water directly from upstream. So the condition of their actual geographic upstream watershed matters less than the municipal water system they're probably in. So this relationship between nature and health can get broken, that yellow bar, by municipal water systems. And that's probably one of the reasons, along with others, that the signal's stronger in rural areas. So this, by the way, has been led by two amazing postdocs, Alicia Ellis and Diego Herrera. They both moved on to Duke and the World Bank. Okay, so that's an example. Big data set, nested hierarchical models, to try to, while controlling for lots of things that we know affect things, identify the effect of nature. Here's another one. Protected areas now, not forest as a land cover, but protected areas as a policy, and its effect on poverty and health in children. And so this question again is, how does proximity to protected areas affect stunting and poverty among kids? This one is led by Robin Naidu. He's been a colleague of mine for almost 20 years, first at World Wildlife Fund, and now he's still there as a researcher, and we continue to collaborate. Very, very clever guy from the field to this kind of data science. So he essentially took the World Database of Protected Areas and took all the clusters in our database. Again, a cluster is a group of households that is like the experimental subunit in the surveys. So what's geolocated is the cluster, and then there's a bunch of households that are associated with that one point. So that's what I mean by cluster when I say that. So he took all that cluster, then he just measured their distance to the nearest significant, and he divided it into close and not close, under 10 kilometers from the nearest one and further than 10 kilometers. So here's a zoom in of Nepal, relevant. We've been talking about Nepal a lot the last couple of years. And you can see where some of them are closer, but most are not, that kind of thing. So this is his sort of natural experiment. And then again, just the careful econometrics to see what differs in terms of health outcomes among those proximal versus not. And these again are the results. I hope you can see them from there. But what this is showing again is various factors from urban residency, breastfeeding, education, and so forth, things to control for. And then the bottom four are different kinds of protected areas. And the different colors and whiskers are two outcomes, each measured two ways. So stunting and then height for age, and then poverty and then household wealth. So the top two, the red and diamonds, are kind of measuring the same overall phenomenon, the bottom two, the same one. And the big interesting take home for me here is that protected areas improve outcomes for both stunting and poverty, but only when people have access to the protected areas. That's the difference between those four clusters of points there. The higher ones are IUCN classes with more access allowed. And the bottommost one is the strictest definition of protected areas, which excludes people all completely. So again, an intuitive result that protected areas, one pathway of affecting human health is only possible if there's access for wild harvesting or other income generating activities. And when you take away that access, this global pattern goes away. Okay, so this is really broad, multi-country course relationship discovery type research, right? Like the mechanisms are impossible to know from these data sets. We need to sort of infer them and then go test them in other ways. But again, finding that proximity to protected areas improves both a health and a wealth outcome. Last example I want to show you, and I'll do it quickly so I can do the second part of the thing too, is about nutrition. So forests and nutrition. The question here is, how does proximity to forests, again, the land cover, not the policy, forest now, how does it affect diet diversity among children? Diet diversity is not a health outcome, but it's related to a lot of them. So this in itself seemed like an outcome variable of interest. Another very clever postdoc, Renaiva Rasolevsen, who's now at University of Toronto, ran this one, and he did the same thing Robin did. He constructed a natural experiment at proximity. So he found matching households within 3 kilometers and beyond 8 kilometers, used statistical matching from his economics background, and found that, yeah, those closer had a 25% increase in diet diversity, measured as the number of different food groups consumed per day on average. Interestingly, again, not for everybody. So he found the impact, that is the difference between those treatments, the difference between the 2 proximity groups vary a lot by the economic activity or the sort of relative wealth of the region. So that difference, that improvement was strongest for relatively low-income regions of the study. Also, it got stronger for higher education among parents, and we can talk about why that is. So all these things kind of repeatedly say to me that these forests have effects, but those effects aren't homogeneous. Different people enjoy them differently. And that's a really critical part of all these stories. Okay, so just to sum up, that was a lot of graphs and a lot of different things pretty quickly. But what we're finding when we look back over 10 years of doing this work and picking out just a few of the studies is that forests help, but not for everyone. Same, at least. So they reduce diarrhea, but only in rural households. Increase diet diversity, but more in poorer regions. They reduce stunting, but only if parks are accessible. And they reduce malaria, which I didn't show you for time, but more in poorer households. So forests are a contributor to public health, but again, not in a homogeneous way. So say these very broad data science approaches. Okay, let's revisit the little chain that I showed you and see how we did with this thing. And my answer is not so great. Really all we had was data on ecosystem change, a little bit on the policy. We can light up policy for the protected area thing. We had a bunch of mediating factors that we took account of, and we measured the health. So this is what I'm saying. Those middle boxes grayed out. That's a lot of the mechanism that this kind of approach doesn't really let you illuminate. But we still find that again and again, across many countries spanning cultures and biomes and biologies, we find a general signal that's consistent with the signal from many, many case studies. Strong enough to show through all that variation. Forest and conservation improve children's health. They can do so. The signal is strongest for the most vulnerable kids, and it's general enough to detect at these international scales. Okay, now we're just gonna take a hard left turn. Yep, super different project, but I've heard in the last day that a bunch of people are thinking about mental health here, and a bunch of people are actually using things like social media as a research instrument. And so I thought it'd be nice to share this part of our work too. This has more to do with mental health than physical health outcomes, more about urban and suburban regions than rural ones. And we have focused so far in the US as opposed to lower and middle income countries. The overarching question here is, how do park visits or time in nature or exposure to green space affect mood? And what I'm going to show you is how we've tried to get at this by using social media as a research instrument. This is Laura Saunders. She helped with the very beginning of this on a project in Vermont. She's now a professor at University of Queensland. So there's a lot of reasons to think that there are psychological effects of nature. This has been shown a bunch of times in experiments in labs and other things. Evidence that it improves moods, reduces stress, improves cognition. People do better on simple tests. What I didn't list, but is also really interesting to me, is it improves the amount to which you are more sort of other regarded, pro-social, less about yourself, more about the community. So I think this is another really interesting argument for conserving nature in a very different setting, in the places where people are concentrated, cities. Okay, So University of Vermont has an amazing place called the Complex Systems Center. They have, since the beginning of Twitter, had a research agreement with Twitter, and they received a random 10% of all tweets every day. That's about 35 million tweets a day. That relationship ended when, what's his name? Elon Musk took over. He cut off all these resources. So the data set's now aging. We can't do it anymore. But for a good long 15 years, we had a really amazing sample of tweets and a group of people who got very good at carefully reading. So I'll show you more about that in a minute, but a bunch of studies, if you're aware of this, about nature and human health, mental health and nature exposure are either small experiments with like 50 people taking a walk in nature versus a walk in urban, or they are broad GIS analyses. Is your neighborhood green, and are your like maternal health outcomes better as a result? And I think there's a big middle ground between those. One of them is very few people, but very clear on the exposure they got. Another is many more people, but not at all clear about the exposure. Just because there's green nearby doesn't mean you go there. And so we were trying to find a way to kind of bridge those two weaknesses and strengths, and this was our attempt. So study session with San Franciscans on Twitter. It's the densest Twitter use in the world, so we went there. And we have thousands and thousands of people, so it's not 60, and we can follow them. It's a little creepy, but we can follow them geographically as they move in and out of green space, as long as they message it. So every message for a lot of years was geotagged. And so we can follow them as they move in and out of green space and listen to what they're saying. So we know they're actually in it, they're getting exposed. And there's a giant variety of parks. This is all led by Aaron Schwartz. He's now a data scientist working for companies, but he did this as a speech. Okay, here is the main kind of product from this project at UVM. It's a daily update on the nation's overall mood via Twitter. So they have scored the happiness of 10,000 words, and they use the frequency of those words and messages for the relative happiness of those messages. They can identify words driving change, and you can see events that move this thing a lot, like the storming of the Capitol and so forth. And the most important thing to know about this is they're good at doing this. Like, I was skeptical and now believe that it actually correlates to true things. And they have correlated it to just about every other US well-being survey there is, and it predicts it really well. So say what you want about bots and about the crap that's on Twitter all the time. In there, when you can filter it well, is a signal of happiness that correlates with the ones that Pew uses and Gallup uses and all that stuff. So it's a validated happiness tool. Okay, what Aaron wanted to do was follow people as they moved in and out of green space. And he set time zero at the time when people entered a park and messaged from it. And then he looked backwards to see what their baseline happiness was. And he looked forwards to see what maybe some post-nature glow, he called it. So what's the baseline? What happens when you're in there? And how long does it take you to return to baseline? All measured with this kind of goofy and shit. Okay? And that's what he hypothesized. There'd be a spike, there'd be a glow. At some point, you return to baseline. And that is just exactly what he found. So these are all the data. So every visit to every park by every person is like collapsed into the same time zero. And then everything else is like averaged over it. And there's a baseline, there's a spike, there's a 6 hour where it's statistically higher than baseline, and it goes back to exactly the same baseline. So that's the average for San Francisco. The clip, yeah. You go back. What's the effect size? That 80, how much happier is it? It's like you're a plant. I forgot to say that, and I'm glad you said it. These are totally meaningless units. It's their index. But 0.24 is a really big unit. And the way to think about that is to find the happiest day of the year on average, which is Christmas Day. Say what you want about that, but that's the biggest spike on average. And its departure from the average mean, from the annual mean, is the same. So the biggest departure is the same magnitude as this brief signal. So that's what some of the news coverage was on this paper. Like, a park is just like Christmas. It just missed the point. But anyway, That's how you know how big it is. That's the only thing to say. Okay. The coolest thing he did, I think, is he disaggregated park types to try to get this green thing. Because when you're in a park, you are lots of things. You're not just in greenery. You're outside. You're not at work. You're probably with somebody you like. Those are all things that improve your happiness. So he tried to separate different types of outdoor spaces and showed that the ones regional parks and neighborhood parks have a much higher magnitude of that bump than outdoor places that aren't at your desk but are mostly concrete. And he quantified the greenness of these places. So I think that bottom one, the Civic Plaza, is evidence that being outside is good for your mental health. But the difference between that and the next two are evidence that green is an additional benefit. So that's where I would like maybe pause it in this kind of goofy way, is the marginal gain from the actual green stuff. Okay, so here's a quiz. We're close to being done. Here's a quiz to wake you all up. So, of course, the first thing we wanted to do once we had those results was repeat it all over the country. And so first, I just want to ask what your prediction is. So of the 25 largest cities in the US, which has that highest delta, the highest mood bump, where is green space generating or related to the biggest change? Chicago. Okay. All right. Settle down, everybody. Who says San Diego? Okay, cool. Who says Chicago? Who says Indianapolis? Nice. Who says Washington, D.C.? Lots of parks in there. Who says Seattle? Come on. Yeah. As someone from Seattle, I don't know how to feel about it.
They have to.
Yeah, they got big baselines. Yeah. See, you can think about things like this. All right. So one person is right, whether it's Indianapolis. Again, all this whole talk is like big data science stuff, like mechanism is hard to infer. But the two things I take away from this graph, I'm just going to let you look at it because like no one listens to this 30 seconds after it shows. Everyone's looking for their home city. Okay. Everybody's positive except for Baltimore. So this is a general thing. We can quibble over who's higher, but like everyone's statistically positive in the effect that in the association there is between happier messages and space, right? And then there's big variation in the size of that, and some very unintuitive places are different unintuitive spots on the rank. We tried simple things like investment in park system, political mix, racial diversity, amount of green space. None of those are related in interesting ways. So there's a lot to kind of think about, and I'm sorry, I can't tell you a lot mechanism behind. Okay. Again, checking back on this framework, I think we did the same kind of good job. We sometimes had a policy, sometimes had an ecosystem. Well, we had a policy. Open space in cities caused a change in land cover and ecosystems. We had some mediating factors and health outcomes. And I think what we've learned is that very often time in urban parks can improve mood. Again, we see that over big groups of people, heterogeneous groups of people, although Twitter users aren't representative of everybody. We find stronger effects in green parks compared to gray ones. And I think this can help motivate and target and guide urban green space efforts. The last thing I want to do is just sum up with a couple of general thoughts. One is how to do, well, those thoughts are all about how to be better at this. One thing I think we can do to be better at this is link this broad stuff with mechanistic studies at local scales, right? There's lots to be learned beyond what we're learning with these broad databases. Here's a good example. Dr. Quick, he's doing actually field experiments on how deforestation changes reproductive rates and development rates in malarial mosquitoes, right? Testing the mechanism we think is happening behind our big data stuff. Also, there are really great examples of local experiments on the urban nature health thing. Eugenia South, who's at Penn, is my favorite example. She's got a giant randomized control trial of re-greening blighted, abandoned lots and measuring mental health surrounding communities in Philadelphia. So look that up. It's really cool. Our own attempt to get a mechanism involves these Oura rings. We have a big experiment now around Vermont where about 1,000 people are wearing these rings. We can follow them and measure their dose of nature through this app. And then we've actually instituted our own experiment. We've divided it into 4 groups, and they get augmented nature or exercise or therapy. and we measure their mental health through their stress as measured by the rig and through weekly surveys. And the postdoc, Laura Bloomfield, who's on the upper left there, just sent me this last night because I've heard you guys talking about it so much. This is the nature and the control or blue and the other two treatments are kind of, so we're seeing over time, this is over weeks, heart rate variability, which is an indicator of stress, depart for the group receiving the nature. I would love to spend more time on that, but just commit. I'm going to skip that one because it takes a while. I think one of the most important things to think about is not the overall benefits on health, but I think the distribution effects, the equity effects of who benefits from an ecosystem change and who bears the health costs are enormous. From downwind people, from forest fires, only those that are unlucky enough to be downwind. And then this is an amazing thing for Richmond, Virginia about tree cover as it relates to redlining policies in the US. And racist redlining policies of decades and decades ago are still showing up in tree cover and in climate change related illness in cities all over the place. I'm going to skip this one too, just like things aren't linear. You guys know that. And to make one more interesting point is that I think, especially in the mental health stuff, another way to get better at this is to represent everyone. A postdoc at the Gun Institute, Carlos Andres, he just read every mental health Nature paper there is and tallied where they took place, who they involved, and what they reported about identity. And he found that 90% of the studies are from what he calls weird countries, Western educated, industrialized, rich, democratic countries. And the participants are overwhelmingly white, and most of the studies don't report anything about ethnicity. So we know what we know about nature and mental health from an unbelievably biased subset of people. And that's another way that we have to get better. We can do the same thing on lots of other health outcomes. Okay, so final thoughts. I think global change impacts human health in lots of diverse ways. I think there are these big data sets that can help us understand general patterns. Investments in nature, therefore, I think can be considered to be legit public health investments. We have put some of the effect sizes of nature up against things like bed nets, and they're on the same order. So they're not this little rounding error. They're not like a cheap little story. They are an intervention that has an effect size equal to improving sanitation in someone's home. The stuff that the World Bank is spending a ton of money on, like it's tons of money on foundation. Nature interventions have similar effect sizes to those. And I think it's also just an absolutely fascinating area of research that is new and could use a bunch of collaboration as a result between public health and sustainability scientists. So that's what's most exciting about this visit to me, is all those conversations that we've already been having. Okay, thanks to all these people, and thanks to you for listening. Okay, now you got me started with the Zoom question. Got it. Okay.
So first question, what kinds of responses have you got from global folks when you hear about your work? What points resonate most policy?
Yeah. So global health folks then means like people in policy and global health, because the reaction is different among public health officials and policy. It's been really enthusiastic in the sense that those people primarily thinking about global health and economic development are really interested in how conservation can actually be a tool for that. And conversely, people in global conservation, like for Wildlife Fund, are really fascinated by how what they're doing for wildlife can also help people on the health side. No one is expressing like outright skepticism, like, I don't believe this. Most of them go straight to why, right? Run right into like the lack of ability to test a mechanism. But they are impressed that, again, across all these countries, this signal emerges. Yeah.
Thank you for presentation. My question is a little bit cross-based, but I actually there was doing studies and thinking about how a lot of indigenous practices that a lot of cultures believe that the human body is part of nature. I'm curious, how can work, in your field, and will help is about climate change as well. The benefits from, indigenous studies and understanding that connection where, nature is one thing.
Yes, exactly.
So there is throughout your experiences as you navigated that and or ways that the field itself and push itself further incorporating.
Yep. No, it's a really, really good question. And it is, I don't know if it's ironic, but it's just really kind of too bad or something that most people who study like indigenous ways of knowing about relationships with nature, or most people I talk to who are from indigenous groups and describe their own experience, take a look at this, unlike the public health professionals, and say like, yeah, like, duh. And so they say exactly what you say, is that this separation doesn't even make sense. Like the way you frame your question, how does this affect me? There's not the distinction there. And I guess I think that one of the ways to get back toward that, given we have the kind of view on nature that our Western societies now have, is to show how connected and interrelated they are, even if we're still calling ourselves different things, as a way towards understanding that actually we're not. Like the more ways we find that like nature affects our health or our well-being or everything else, it could be a way to sort of like talk to Western-minded people about the fact that there isn't a distinction. Don't say this. And that language is all over my talk, right? Like people and nature. I'm studying people and nature. But it's, I think, fascinating and impressive to me that distinction just doesn't exist in most other cultures, literally most other ones. But getting us back there, like, start with pointing out how we still use that word. Thanks for the question.
Yeah. So, here, can you discuss the importance of biodiversity for maintaining those that are essential for follow policy implications? What should government prioritize? Public health.
Yeah. Okay. So you notice that like a lot of this just had to do with land cover. So it didn't take into account how biodiverse a forest was, or just like it's forest, or it's a protected area, or it's green space. So I really appreciate that question. There's all kinds of work at other scales showing again and again and again the importance of biodiversity for the generation of these services. So biodiversity, soil microbes, wetland plants, soil insects in water regulation and purification. So it's not just stuff, it's like the diversity of stuff matters. The diversity of forests in sequestering carbon is really well known. So there's niche partitioning amongst species so that a diverse forest will do a better job of cycling nutrients, including carbon. Certainly on the diet diversity and things like a diversity of plants, not a monoculture of tree plantations where wild harvested foods will come from better. So I think there is tons and tons of evidence that not just forests, but diversity of those forests is important. What should people be doing was the second part question.
Yeah, specific policy.
Yeah. Yep. I think a lot of conservation is about spatial decisions. I worked at World Wildlife Fund for 10 years, and that's what we did. We asked the where question. We don't have all the money we need. We will never have all the money we need. Let's be strategic about where we invest in purchase, protection, community development. And I think the most important message from this talk is that priority setting needs a new objective, which is not just biodiversity per se, but health and other well-being components of that conservation for people. That's going to maintain the kind of public support for conservation. And it's also going to, has the chance of solving two policy challenges, which is global health and global health. There are, not everything's a win-win, but there are win-win places. We won't know that unless we prioritize both for biodiversity and for stuff like this. This is why World Wildlife Fund funded this research. So they wanted to know where conservation could also benefit health. And it's why USAID funded this research. They wanted to know exactly the opposite, where their development work could also help biodiversity.
So trying to figure out one. So my background actually is a medical. I'm doing master's. Yeah. So I'm really interested in using alpha data, but for the same reasons I think. But one thing I think about a lot is one, the issue of conservation and the ways that those have prevented it, but also then in an urban setting, green space projects, gentrification, pushing out often low income Black people. When you add green spaces, I think those probably that I don't see it as that, but I'm just curious as to how you feel like I sometimes think these research things are great, but then they promote these things that cause this like
Yep.
I'm wondering how they
That's a really good question. I think they are really analogous. I think they're related. Conservation of either urban or wilderness that forces out more vulnerable people in both cases. That's like the general thing that would describe both things. I worry about that a lot. I do not have like a ready, like, here's how we fix it type of thing. And part of the reason is, well, actually, Jeannie South and I talked about this a bunch. She is the one doing the Philadelphia experiment on restoring vacant lots. And I think there is a way to, trying to say, she's hopeful that there's a way of doing urban, which actually doesn't set off that gentrification spiral. And her work isn't showing any gentrification. It's just showing mental health. I think has to do with, actually don't know what it is. She'll say it has to do with the kinds of open spaces being produced and the sizes of them. Yeah, okay. Right. Like this isn't like the High Line in New York or something. They're small, unlikely to sort of touch off this spiral. But I wish she were here. She'd have a better. It's like